You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says your teeth are never too bad to have the smile you've always wanted. With us, we have an expert on the topic. He calls it full mouth reconstruction, Dr. Mark Hanna. Dr. Hanna, welcome to the program.
Thank you. It's a pleasure to be here.
Now, you brought a lot of photos, so we'll get to those.
Okay.
Now, for people that don't know your practice, like who's your typical patient? Because you do a lot of things there, I guess.
Yeah, we do a lot of things. Technically, we don't have a typical patient, but if you were going to title us, we'd be considered like a family practice or a general dental office. But we really are much more than that. We're like a office that does all types of specialties under one roof without bringing in a whole bunch of specialists. We do a lot of implants, single implants.
So you're big on dental implants?
We do a lot of implants, yeah.
Okay.
We single, multiple, full mouth restorations. So we have our own CT machine in the office, which is a 3D X-ray machine that helps us to see vital structures like nerves and sinuses and how much bone patient has, so we can put the implants exactly where we want them to go so they look very natural. And then we also have patients who have a lot of ill-fitting dentures or loose dentures that are, tired of the dentures moving around. So, we can put multiple implants in and snap those dentures in and keep them, solidly in place. And they can get rid of their glue and
Okay.
They're not embarrassed anymore. They're not afraid, their teeth are going to fall out in front of their friends or their grandchildren. And we do a lot of that. And then there's some patients who want a whole new smile just fixed on dental implants. And we do that as well in our office. Procedure called hybrid with just 5 or 6 implants in an arch, and we get them a whole new smile that doesn't come out. It's very natural. It looks like their natural teeth, and patients go back to eating their favorite food: steak, apples, salads, ribs.
Is that right?
Yeah. And we also we are considered a sleep center. We do a lot of sleep medicine, and so patients who have to wear a CPAP machine, which is, I don't know if you know what it's like, but it's a big, ugly contraption, makes you look like Hannibal Lecter, and a lot of patients hate it. So we can just with a small dental appliance, we can have them get rid of that CPAP machine. And then, the best thing, in our office is that whether you need a little dentistry or a lot of dentistry, we can do it under the comfort of you being asleep while we do the dentistry. We do sedation dentistry, oral conscious sedation, and patients come in, and as little as 1 or 2 visits, we get them back into full, oral health and their smile back and functioning again and back to, their life, without.
So it's safe. Oral sedation is safe?
Oral sedation is the safest type of sedation out there. I mean, we're just using pills. There's no needles. There's no IV sedation, okay? And just a couple of pills. You're asleep like you're asleep in your bed at home, but just a little bit deeper. You're monitored the whole time, and so it's very, very safe. And we can get hours and years of lost dentistry done in a few hours, okay?
Is that right?
Just with some pills.
And they have like a vague memory? Is that true?
They remember when they first came in the office, all right, but once they go to sleep, they don't remember the needles, the drillings, implants, root canals, nothing. They wake up and everything's done for them. And the best thing is the next day, they feel great, okay, because the sedation, they're greatly relaxed the whole time they're, sleeping. So the nerves are not on edge, they're not, worried, they're not fearful.
Okay,
so
good point.
we do full, a lot of surgical cases, and those patients go back to work the next day just on Tylenol and Advil.
So the photos that you brought, and these are like, we call them extreme smile makeovers at the top. These are people with really broken down mouths.
Yes.
Would you say that all of them took advantage of the pill? A sedation?
Yes.
Oral sedation pill?
Yes. When we're doing bigger surgical cases, you definitely want to be sedated, okay? Because it's amazing how much the sedation actually helps with post-op pain and discomfort. Okay?
Oh, really? Okay.
When you are sedated, like I said, we extract full arches of teeth, we bone graft, we put in 6 implants at the same time or 5 implants, okay? That patient goes back to work the next day or their daily routine, okay, just on Tylenol and Advil.
Okay.
So it's amazing. It's always, it's been amazing to me how effective it is just with a few pills that you can get somebody to do this much work and feel great the next day.
So we've invited you on the program today to talk about what you call full mouth reconstruction. So for a working definition today, what does that mean? Full mouth reconstruction.
That's an excellent question. Full mouth reconstruction can mean a lot of things. Okay, it can mean somebody with several broken down or missing teeth. Okay, that can be restored just with regular or cosmetic restorations, crowns, veneers, etc. Okay, it could be a patient with several missing teeth that need implants to replace those teeth and get them back the smile that they wanted. There's other cases where, you know, the teeth are so broken down and they're a hopeless case, okay, and they're not going to last the patient, you know, another few years. And so now we're talking about taking out the teeth and replacing those teeth with dental implants, which act like the roots of your teeth and preserve the bone, and then getting them a whole new smile on those teeth. Okay, so it's very natural. It's just like your natural teeth. You can eat, you know, whatever you want to eat again, steak, salads, etc. And so there's different tiers of full mouth reconstruction.
You say you like to save teeth though too.
Of course. I mean, we're in the field of oral health. Our goal is to save teeth whenever possible. So we try to save as many teeth as we can, okay? And not everybody has to lose their teeth. You know, we try to save their teeth with root canals, crowns, et cetera, if we can. But then there's certain cases where the teeth are hopeless and they're going to get a long-term better result with a dental implant or, you know, a full prosthesis on dental implants. But whenever we can, we'll save that.
So if you're only missing one tooth, why get a dental implant over a traditional bridge?
That's a great question. So a traditional bridge is something that's been around for decades, okay? And before implants came around, if you wanted something fixed in your mouth, your only option was a bridge, okay? But a bridge, you know, has many downfalls. Number one, usually you got to prep two healthy teeth next to it, okay, just to get that missing tooth.
Shave them down a little bit.
Shave them down, okay, completely all around, okay? So now you're destroying two healthy teeth to get one tooth back. That doesn't seem too fair, okay? The second problem is that, you know, with the bridge, the bone underneath that missing tooth, okay, is still deteriorating over time because an implant is the only thing that's going to preserve that bone, all right? So when you have a bridge, over time, you're going to develop a little gap, you know, between the gum tissue and that missing tooth, and that's usually a big food trap. So over time, usually one or two of the teeth that are holding up the bridge gets decayed under there because it's very difficult to clean, all right? So even if one tooth gets decayed, that whole bridge has to come off. So you lose the whole bridge. You might have to replace it, or now you have to make a longer bridge, okay? So, you know, those are the downfalls of having a bridge over something fixed like an implant, where the implant preserves the bone in the area. You don't have to touch the teeth around it, okay? It's very natural. It's never gonna decay on you, all right? It's all parts. And you get to keep it probably for the rest of your life. The average lifespan of a bridge is only about 10 to 12 years.
Is that right?
But the average lifespan of an implant, if you look up online, is about 30 years. Really, it can last you the rest of your life, okay? But nobody's willing to, you know, kind of put lifetime guarantee on it. But really,
well, why does everybody do it? I mean, if logically it makes sense. I mean, if you're missing one tooth, just get an implant, get your tooth back, right?
Right.
Is it just because they hear surgery and they panic?
Is
that what it is?
That's one aspect, okay? People,
or is it cost? I mean, what cost?
There's several reasons why, you know, people don't do implants, okay? Number one, they think it's a painful procedure, okay?
It does seem painful.
And it's not painful. I mean, you know, if the bone is there, even if the bone is not there and we have to grow bone back, which we do predictably on a daily basis, all right? But if the bone is there, it takes about 10 minutes to put in that implant. It's faster for me to do an implant than to get you a new crown on a tooth. So, you know, pain, you know, there's a little discomfort, okay? But it's not something major or relevant, or that, you know, we really worry about in our practice. Because also, a lot of times we're doing these surgical procedures, even if it's a single tooth implant, under sedation. And so, like I mentioned before, these patients really have no pain the next day. Tylenol and Advil will take care of it. So it's not a big holding back factor. Other patients think that, you know, they start looking at their mouth and they start counting all the missing teeth, and they start to think that, oh, I need an implant for every missing tooth. Okay, and they start, you know, calculating the cost in their head, and they think that this is going to be overwhelming. There's no way I can, you know, afford all these implants, which is not the case.
So especially if you're missing one tooth, get an implant. Do you think it'll stop the snowball of further losing more teeth?
Absolutely.
Okay.
Because if you have to replace that bridge, you know, one time in your lifetime, which, and like I told you, the average bridge is about 10 to 12 years. If you have to replace it just one time, you've already paid, you know, twice the amount of just getting an implant.
So it's less, for sure.
It's in the long run, you're going to save money.
Okay.
You're going to save money. You're going to save the healthier teeth, and it looks more natural.
Okay. Now, on the full mouth reconstruction crowd, these people with broken down mouths, and we were talking a little bit about it in the green room, that people with bad teeth are prejudged or discriminated against as far as maybe they look poor. Elaborate on that.
You know, people with bad teeth, your smile and your mouth, it's right there in front of you.
Okay.
It's the first thing that somebody sees when they approach somebody else. So these patients with bad teeth or bad smile, bad breath, etc., it really kind of like holds them back in life. Or they don't smile as much. They don't laugh a lot. They're reserved.
They tell you this?
They tell me this. They figure out how to do things or position their mouth or their lips in certain ways, or their hands. They start to cover their mouth when they're talking because they're embarrassed. I had a gentleman who was really a bigwig in a company near my office. He was like the CFO of this company. And when he came in, his mouth was really broken down. And he was thinking about it for 2 years. I mean, this guy is on a podium almost every day. And he's talking to his staff. He never smiles, okay? When he came in, he was, overweight. He was kind of like depressed looking because he didn't smile. He looked, angry most of the time. He told me, my team thinks I'm angry because I never smile. And he was obsessed with it. Like every time he got on the podium, he wouldn't, smile, and he thought about it while he's giving his talks. So then he came in, we redid his smile, and right before my eyes, this man's life transformed. I mean, he lost like 40, 50 pounds. He started dressing sharp. Before he looked,
is that right?
Yeah. Before he looked sloppy, he started wearing nice suits. He was smiling. You could see his smile from the parking lot. I mean,
Okay.
He was so happy about life. It literally transformed this man's life, and he was much more charismatic. He was much more outgoing. And
Is that typical? Like you fix their teeth, something that bothers them, and now they're changed.
absolutely,
Really?
absolutely, because smile is extremely important.
Well, you're a dentist. It does not surprise me to hear you say that, right? The smile is the most important thing, probably, in your opinion.
It is definitely the most important thing, and not just because I'm a dentist, okay? If you look at most surveys in health and beauty magazines, all right?
Okay.
One of the top 3 most attractive personalities or qualities about somebody else is their smile.
That's true.
All
Yeah.
right, if not number 1, okay? That's like I said before, it's the first thing that somebody sees when you get approached.
All right.
It affects our daily lives in so many aspects. If you go for a job interview, there's 2 candidates, okay, both equal qualities for the position, okay? I guarantee you the one who's smiling more is going to get that position, okay? Even if somebody has less qualities or less, qualifications for the job position, if they're smiling more, I bet you that employer is going to pick that person because it shows charisma, it shows enthusiasm.
That's a good point.
That person is more trainable than the person who's not smiling, okay? Smile, ignites romance, okay? I mean, when's the last time somebody wanted to get intimate with somebody who was frowning in their teeth, they had bad breath? I mean, that just doesn't happen, okay? I mean, so it affects, everything we do. It builds charisma, it builds self-confidence, okay? So it affects all aspects of our life. So, I mean, to give you an example of that, we had a young girl, all right, who, unfortunately, in her 20s, her teeth were really starting to break down, okay? She had decay everywhere, and she was miserable. She was in a lot of pain, and she never smiled, and she was unhappy. I mean, it's a young, pretty girl that doesn't smile anymore.
Okay.
And we transformed her, we got her a brand new smile, and when we handed her that mirror for the first time, she just started crying. She was so emotional that, it was, the first day for the rest of her life. It was
It's a big deal.
It was a huge deal, and that is extremely rewarding for us. When we can do that for somebody and we know that this person, their life is going to be transformed from this point on, that's just awesome.
Nice. Can you be too far gone? Like if somebody has advanced gum disease or bleeding gums, bad breath, I mean, can you be too far gone to do it?
No, really never.
So you've never met anybody that's just too far gone?
No, really never. I mean,
To give them a beautiful smile again.
there's always some type of hope for somebody. Okay, whether it's on their own natural teeth, crowns, veneers, etc., or with dental implants in a full fixed restoration. There's always something that can be done for a patient to make them better.
Now, in your office, because you're big on technology.
Yes.
This cuts down on downtime, makes everything faster by having everything right there, obviously.
Everything. Okay, so in our office, we don't have to shuffle you around to all different specialty offices. Okay, get your root canal done over here, get your implant done over here, etc. We do all that under one roof. Okay, and I do all that myself.
Okay.
it just makes everything faster. Okay, if we need a 3D X-ray, I don't have to send you to a different place just to get that 3D X-ray and wait for it. We do it in the office the same day. A lot of times we'll do a free consult for implants and check out how much bone they have right on the spot. In 9 seconds, I can take a whole 3D X-ray with our CAT scan machine and let you know if you need bone, if you don't need bone. And we grow bone predictably every day.
Is that right?
And so this is not an excuse. People self-diagnose or say, "Oh, I don't have enough bone," or the other doctor told me I don't have enough bone for dental implants. And maybe in that practice or that with that doctor's training or skills, maybe they don't have enough bone to do something. But in our office, we can always grow that bone back.
Do other dentists ever refer you people?
Yes, all the time.
For the complex stuff?
Yes.
For the big cases? So you brought some photos. What are we looking at?
Yeah, so this patient right here, okay, lovely, young, 80-year-old patient.
All right.
Okay, and we treat a lot of patients in their 80s or 80 plus. And she came in and she had a special medical condition called dystonia. Okay, dystonia is like Parkinson's, where you can't control your shaking and everything like that. Okay. So we couldn't even take an X-ray on her without her moving to take the X-ray to get a clear shot of the teeth. And she was afraid of losing all her teeth. She knew she couldn't tolerate a denture for the rest of her life. Okay, with all that shaking, there's no way you'd be able to keep that denture in. So we gave her a whole new set of teeth, a whole new smile, and she wanted to look young and healthy and smile and without dentures or for her grandchildren. She wanted to be in their photos and be part of their life without worrying about having something fall out of her mouth, etc. So we gave her a whole new smile, and
nice.
We got it in for her. She wanted it before her 82nd birthday, and we got it done for her, and she's just a lovely, happy, energetic patient.
Is this one of those things where they wish they would have done it like years ago?
Yeah, a lot of these patients, after they get it done and get a whole new smile, they wish they'd done it years earlier. Okay, here's another patient, same scenario. Came in, older patient in his 70s, and we
Is
got
that gold? He's got
that's gold on the front teeth, but that's because the porcelain on his bridge chipped off, and that's the gold underneath the porcelain.
Oh.
Okay, and that's what he's been smiling with for years. I mean, he wasn't smiling until we fixed him up and gave him a whole new smile, and we got him back to smiling again.
Wow, totally different. So when a guy like that sees the mirror for the first time, I mean, does he get choked up?
Yes, he does. He does. We actually have a video of him on our website. The first time he looks at his new smile. He's a great guy, great patient. We love him dearly, and he's just so much happier, and really just life transforming. Here's another gentleman. The problem with a lot of patients is they start to self-diagnose themselves. Okay, so here's a patient where really his wife was diagnosing him. He had uncontrolled diabetes, and she didn't want him to. He needed some implants and some other restorative work.
Now that's got to be unusual to see something this bad.
It's not unusual, okay? Patients that look like that don't end up smiling a lot. So, I mean, most people around them don't see it because they're not showing it, all right? But in our office, we see this type of stuff all the time. So
I interrupted, but you were talking about his wife. His wife was saying, you're too far gone. There's nothing you can do with your teeth.
He's too far gone. He was uncontrolled diabetic, and she thought that, whatever we did for him, because he couldn't, manage his diabetes, he wouldn't be able to manage his teeth, and it wasn't worth the time or the investment, okay? And I was surprised because when I called his physician and talked about, our intentions and what we were planning on doing, some surgery and stuff like that, and getting him a new smile, he actually told me that, he thought that was going to help better control his diabetes, okay? Having any infection in your mouth, all right, and I've been a diabetic for over 30 years, okay?
You're an expert on the topic.
I wouldn't say an expert, but having any type of infection in your mouth or in your body, all right, makes it very difficult for you to control your blood sugars, okay? So when you get that infection out and you restore somebody to good oral health and smiling and functioning and everything like that, you have better control over your blood glucose levels, and your numbers get tighter, and you actually become healthier. And that's exactly what happened with this guy.
Nice.
I mean, we restored him, gave him a brand new smile.
Look at this.
And his diabetes is much better controlled. He's a lot happier, and he's doing great. I want you to take a look at these pictures side by side, all right? Most people, when they see a person, if they see it, okay, if the person, happens to smile or, exposes their teeth a little bit, they start to think, wow, this person is, either poor or they're, very lazy, they don't take care of themselves. And that's not the case. some patients end up like this because of other medical conditions. Medicines that they've been taking that give them dry mouth causes decay. It's not their fault, okay, that they're always like this, okay? So, it's very wrong to point the finger at them and judge, okay, that they're like this because of their own doing. Because in our office, we don't judge anybody, okay? We've seen patients who've never seen a dentist all their life, and we've seen patients who've been going to the dentist repeatedly and still, their teeth are failing or having problems. So we don't judge, we know that we can do something for them, and that's the most important thing. And so when you can take a patient that came in looking like that and then transform him into the other image that you see with, his full mouth restored, that just does wonders for the patient.
He's also more handsome.
Very.
We talked about this on the telephone, and I think, well, of course he's a dentist, because you talked about how it can really change somebody's appearance. And in this case, yes. In fact, in all of these cases, they just look like a different,
Yeah, here's another gentleman, almost the same one as I just showed you right now.
Oh, geez.
You look at this guy, he's in his 40s, all right? And you just think this guy doesn't take care of himself. That's not true. He has, finances.
So it's a bacterial infection that's killing the teeth.
Yeah.
In a way.
Yeah. Bacterial infection, patients might be, grinding their teeth severely at night and nobody's ever told them. So their teeth are like breaking down unconsciously. They don't know what's going on. They don't understand. Nobody takes the time to explain why this is happening to them, And so regardless, whatever the reason is that they ended up in this state, when you can take that same person and make them, look like this, it just does, wonders for that patient. It transforms their life.
Guy like this, do they ever want to give you a hug?
Oh, all the time, all the time.
So when they see their face for the first time, especially a guy like this, he probably hasn't smiled in 20 years.
Exactly. Right? And this guy is very active. Plays tennis, plays basketball. Can you imagine if this guy was like in a set of dentures, okay, playing those sports at like 40, okay, jumping up and down in his dentures, falling on the ground with his colleagues and his friends that, probably have all their teeth. How embarrassing would it be for that gentleman if that happened?
And a guy like this, he takes a pill, oral sedation, hardly remembers the procedure. And then when it's all done, he says, I probably should have done this years ago.
Exactly.
Was this what the common theme?
Very common theme. And we try to,
let them. He probably missed out on a lot of good years.
He definitely
not smiling.
He definitely missed out on a lot of good years. And unfortunately, dentistry is one of those fields where, things never get any cheaper, okay? Like the longer you wait on something, okay, it just keeps on growing into a bigger problem. A small filling, that you leave alone for a while turns into a root canal, a post and core and crown, or the tooth might get lost and now you need an implant, all right? It never, the longer you wait on something, the more, costly and pain involved and time and effort involved to get that tooth restored. So the faster you address it, the quicker you get to it, it's much better off for your overall oral health, for your smile, for your livelihood. So many factors involved, just addressing it earlier than later. So, these last couple of patients, I brought photos in. Lovely ladies, younger ladies, okay. This patient is a nurse, missing the majority of her front teeth. And, dealing with patients every day. She couldn't keep a partial denture in. She had a lot of bone loss, and the denture was loose and she couldn't smile with it. So she left it out half the day and didn't smile. She never showed that, to the patients that she was working on. And then we restored her smile and got her fixed up and something fixed and permanent in her mouth. And, now she's smiling, night and day with her patients. And what a big difference, like when you get treated in a, medical facility, don't you want the nurse that's taking care of you to be smiling at you, show compassion, show that they care rather than being all serious? It makes a world of difference.
So when you give them a new teeth, I guess other people react to them differently.
Absolutely. Like I said, before, smile, makes all the difference in the world. It makes you feel like that person's approachable. When you go to a party, the person who's smiling and laughing and talking a lot, you find, most of the people are gathering around that person because they seem like they have a lot of charisma. They're more outgoing, So you're attracted to that person, okay? Not necessarily, physically. You're just attracted because they're just a happy-go-lucky person. You want to be around people like that. You want to be around happy people, like this last woman again, beautiful young woman. In her 30s, and her teeth were, decaying, and she was having a lot of dental issues, a lot of back and forth in dental offices, a lot of specialists, and she was just tired of all the, nickel and diming and back and forth and fixing one tooth at a time. And it's just a big headache, And so we took care of her entire mouth in just a couple of visits and gave her, a whole new smile again.
Wow.
And,
nice.
When you look at her before and after, just complete change in just a couple of visits while she was asleep.
Now we are short on time. So this full mouth reconstruction, so because of the oral sedation, you could do crowns, bridges, whatever, veneers, a single implant or whatever, all in one visit.
Absolutely.
So things are being done quicker today than ever before.
Definitely.
Is that right?
No more multiple dental appointments back and forth. We do sedation on patients that are fearful, but we also do it on the type A personality patients that, are very busy. They're always on flights. They're always traveling. They don't have a lot of time to spend in a dental office. And you believe it or not, there's a lot of people out there like that. Okay. The world is very demanding. So they just want to get in and get it done, and we can do that for them.
All right there. So when you say you could do like a year, 2 years worth of dentistry in one shot with oral sedation, what do you mean by that?
So, these patients, because of previous past experiences, anxiety, painful situations at the dental office, sometimes they skip coming to the dentist office for years at a time,
Okay.
10, 15, 20 years. I mean, before I came on over here, I just had a patient in my office last Friday who was not going to the dental office in 15 years because when he was younger, he had a traumatic experience. The dentist dropped the drill on his lip and, cut his lip open.
Wow.
And, when you're a sedation dentist, you hear a lot of these stories, and you don't blame the patient for not coming. I wouldn't go either. If that happened to me, I wouldn't go either. And he finally came in to see me and he needed a lot of work, but he was still, anxious about it. But when you can, comfort that patient, let him know in a visit or two that we're going to get you back to square one and even better, okay? It takes this huge burden off of them, this huge mountain that they saw before them that they couldn't climb, and now they feel like it's surmountable, that they can get over it.
So we are completely out of time. Final message though, somebody watching this, their teeth are really bad, right? Like the bleeding gums, the bad breath, all of those things. Maybe they think they're too far gone. They haven't been to the dentist in 10 or 15 years. What do you say to them? And they're still afraid maybe to come in.
I say, come on in. Okay, because there's always something that we can do, all right? And we can take the fear and the anxiety out of it with sedation. So no matter what we do for you, okay, implants, root canals, crowns, bridges, whatever it is, it can be virtually pain-free. It can be done in a very short period of time, okay? We can get you back to full oral health and smiling again, and eating your favorite foods, whatever that is, salads, apples, steak, etc., in as little as 1 or 2 visits. So, make the effort to come in. There's no judgment in our office.
There's no consultation fee.
There's no consultation fee. You come in. We don't judge in our office, okay? We can take care of anything, all right? And we can get you fixed up in as little as 1 or 2 visits while you're sleeping and get you back smiling and functioning and happy and eating your favorite foods again, dating, whatever you want to do. We can get it for you.
All right. Thanks so much for coming on the program.
Thank you. It was a pleasure to be here.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.